You're listening to the Final Say Radio Show, a Rappaport Media production, with your host Brett Rappaport and co-host John Rappaport.
I want to welcome back to the Final Say Radio Show Phil Kerpen, who's the president of American Commitment. Of course, you could always go to AmericanCommitment.org. Go support them, follow all the things that they're doing. They are just a great organization, the watchdog of so many issues that we need to address. They've been all over the healthcare issue and ObamaCare since its beginning. And Phil, welcome.
Hey, great to be with you guys.
Well, Phil, we haven't spoken to you in a little bit. I hope you've had an enjoyable summer, but I also know that you've been very busy because I've been following you.
Yeah, well, the Congress leaves town in the summer, and so usually there's less mischief going on. But with this administration, they don't really wait for Congress anyway, so they're sort of nonstop all the time, and so we don't get the sort of summer break that we're supposed to, unfortunately.
Well, that's absolutely correct. Now, you've pointed out something on the piece that you're working on here, and this is really very incredible, that according to the Gallup polling, the percent of Americans that said it was the federal government's responsibility to make sure all Americans have health care coverage has tumbled from 69% in 2006 to 42%.
Yeah, this is pretty incredible. This big advantage that the Democrats had for years was this idea that health care is a right and the government needs to guarantee health care for everyone. And they made they made enormous headway on that argument, so much so that for years Republicans thought the only way to respond was to say, well, we want universal health care too, but we're going to do it a little bit differently. And this is actually kind of how we got stuck with ObamaCare, because Senator Nichols from Oklahoma back during Hillary Care said, no, instead of that we should do an individual mandate for everyone. And the Democrats kind of put that in their back pocket and said, and a decade later they came back and said, let's push for this, quote, Republican idea as the way to get our health care bill through. And I think that hurt us a lot. They did it first in Massachusetts and then, of course, in the ObamaCare bill. But what's happened in the past couple of years is the American people have seen what a total disaster it is when government actually tries to make good on this idea of government guaranteeing health care for everyone. And as soon as they saw it attempted in practice, the number of people supporting it plummeted. And so now we've got the majority of the American people who don't think that that's government's responsibility, who don't think we ought to have universal guaranteed health coverage for everyone. And that change, I think, is not well appreciated by Republican politicians. They still think, they're all saying repeal and replace, repeal and replace, repeal and replace, like it's the mantra from Frank Luntz or whatever. And, I think this idea that when you get rid of Obamacare, you need another 2,000-page centrally planned replacement to try to redesign a sixth of the economy totally misses the point. People don't think that's government's job to guarantee health care for everyone, and they sure don't think that politicians are competent to redesign a sixth of the economy. So I think the idea of replacing Obamacare with another universal coverage plan misses the point of what's happened with public opinion the past couple of years.
That's a great point. And I just have to say this. At the beginning of your response there, you said total disaster. I actually think that's an understatement.
Oh, it keeps getting worse every single day. I'll tell you guys, I don't know if you saw this. There was a quote. There's a healthcare analyst, an industry guy named Bob Leshevsky, who's just a down-the-middle, industry analyst guy, not a conservative by any means. He had this quote today. I actually just put it out on Twitter a little bit ago. I thought this quote was unbelievable. He said, quote, "The Obama administration has no idea how many people are currently enrolled, but they keep cutting checks for hundreds of millions of dollars a month for insurance subsidies for people who may or may not have paid their premium, continued their insurance, or even be legal residents."
That is...
Every month they're just writing these huge checks to the insurance companies for people, for subsidy. They have no idea if the people are even enrolled, whether they're eligible or anything else.
I don't know how you respond to that.
What else is there to say? I mean, they have no clue. They said 8 million people signed up, and then they actually have no clue how many of them actually ever signed up, and they have no clue how many of them actually had citizenship, how many of them actually had income in the qualifying range, and they're just writing checks to the insurance companies every month, but they have no systems in place to check any of this.
It's of course the reason why clear-thinking, responsible adults willing to work for a living don't like these programs, as you know, Phil, because we understand they're going to be poorly written. I have no problem with our leaders creating public policy, but I want everything to be implemented from a private practice standpoint. I want to get with that in mind, I want to get your opinion on something. I don't know if you've been able to follow some of these trends, but there's two things I'll bring up that I'd love to understand where things are trending. One is the difference costs, what it costs for a physician today, let's say from education through actual practice to become a physician, versus the remuneration, right, the pay, and because what this comes down to is what is the motivation, and if we're going to increase the number of doctors needed, are we actually going to have enough doctors who it makes sense to even join the practice?
Good question. I mean, I don't have those numbers in front of me, so I can't give you any specific numbers, but I'll tell you it's pretty hard to become a doctor. I mean, it takes a long time. You got to go through 4 years college, 4 years medical school. You got to do residency, internship, all of this stuff. It takes a long time. Now, at the end of that, doctors are very highly paid in this country, much higher than most other countries. And historically, most doctors have also been small business people. They ran their own practices. But what we've seen in the past few years, as malpractice costs have gone up and as the regulatory compliance costs have gone up and dealing with the bureaucracies of the insurance companies and the government and everything else, doctors increasingly can't handle it anymore. So they're selling their practices to hospitals and they're becoming salaried employees. There's a lot of consolidation going on in the industry. I think that is that's a little bit of a frightening trend. Some people will tell you it's more efficient that way if the doctors are all, salaried employees of a hospital. And there are some very high quality hospitals that use that model. I think the Cleveland Clinic does, for instance. But I think that the old model where your doctor was his own boss, there was a lot of good in that model also. So I am concerned that we're driving things in a direction through policy that's sort of leading to many fewer providers sort of all networked up with the big hospitals having a lot of the power. And so that's been one of the trends that I think is very negative. But there is certainly a big shortage, principally in primary care. There's a big shortage right now because if you're going to go through all of the time and effort to become a doctor, you're going to want to go to a specialty where you can get paid more. And so there's a big challenge, I think, with getting enough primary care physicians. And some of that need is being met by nurse practitioners. And there's some other trends to try to address that. And there is supposedly one of the things ObamaCare is supposed to do is provide more funding for people to go into primary care. But I think if the market were well functioning, and we didn't have the medical liability costs being as high as they are, which in some states is just driving tons of doctors into retirement or into leaving the state, then we would have more doctors, and people wouldn't be so worried about thinking doctors make too much money. I think I personally, if I'm going to have surgery, I want like the world-class guy to perform it, the guy who should be making a ton of money because he's really great at it. And so I'm not, some people say our doctors are too highly paid, and that's one of the big cost drivers in our medical system. I tend not really to be too concerned about that aspect of it.
Look, it's pretty simple here. You do not want to pull into the parking lot and see the spot marked physician and see like an old used Yugo in there. You want to see a nice car. You want to know this guy's driven, he's motivated, et cetera. And they should be rewarded accordingly. You sort of framed
But I will add this, John. I mean,
yeah.
I think, if we had a working price system with transparency where people could see, this surgeon charges this for that procedure, this other guy, he charges a little less or what have you, and you can make a decision where you sort of weigh the costs against that would be a lot better than now where there's a lot of opacity, I guess is the word, opaqueness. In terms of the pricing. And there are some hospitals and some surgical centers experimenting with that. There's a big one in Oklahoma now where all of their prices are publicly posted. And I'd like to see more experimentation with that. The couple areas of medicine where insurance really isn't in the loop at all, things like LASIK eye surgery and plastic surgery and that kind of stuff, we've seen just huge price drops because of how much competition there is and because the prices are publicly posted. And I'd like to see the rest of healthcare go in that direction.
Yeah, I absolutely agree with you. I believe in all cases the free market model is the best way to go, and I think if you have a combination of small practices, private practices, big hospitals, small hospitals, I think the competition itself will eventually drive people out who don't belong, and the people who are doing the right way, running their practices or hospitals the right way will stay in business and be profitable. But, Phil, I think I've told you this before. I didn't have insurance for, I want to say about 6 months to a year. And during that time period, I went to a doctor and said, I want to have a checkup, and please tell me what it would cost to do this particular thing. And they said, $250 for all the blood work and whatnot. And then I said, well, what would it cost if I had insurance? I said, well, the bill would be like over $1,000, but we wouldn't get paid nearly that much of it. And so at the end of the day, I think if you negotiate with them, you're much better off anyway.
Yeah, a lot of people. I'm hearing a lot of people. I haven't seen data showing that this is like widespread or anything systematic, but I've heard a lot of stories from people that are telling me, I decided with Obamacare my premiums went up. I decided to drop coverage and go uninsured and pay the penalty if I have to. And when I go into the doctor, I tell them I'm a cash payer and I can negotiate these prices that are much lower than what I always used to see on the bills. And so a lot of people don't realize this, but if you're a cash payer, they're willing to take a much lower price. Most medical providers are willing to take a much lower price from a cash payer because they don't have to deal with all the headaches and the bureaucracy and all the rest of it. Most of the insurance companies don't pay the posted price anyway because they have their own discounts negotiated and all this kind of thing. I'm not advising people to go uninsured because I think you probably want to have some kind of insurance for, God forbid you get in a car wreck or something terrible happens. But a lot of your typical day-to-day, your yearly checkup, your blood work, that kind of stuff, you would be surprised what the prices can actually be if you're a cash payer and you negotiate it. A lot of people have told me the same thing as you.
Well, I think you're spot on. There's a major medical aspect, which is the small but devastating chance that cancer or diabetes or whatever it is that could have an enormous ramification. That could wipe out your savings. That could mean you can't afford to put your kids to college, lose the house, whatever. And I think those things are very critical. But I don't like the idea of getting to a point where we're sort of government-created big box medical, because I think that flies into the face, not just as we discussed downward pressure on prices, but I think there's two other things that are very, very important. One is that will stifle innovation, in my opinion. It will create aggregation and of power, so you'll have less competition, but you won't have much innovation. The other thing I think is missing is not just transparency in pricing, but the government doesn't even have to be involved in this. Individual companies, entities, entrepreneurs can come in and create new rating indexes and things where people will also start rating doctors. So all of a sudden, if doctors have a stimulus to practice very good care and try to do so in an efficient way at good pricing, now you have a balance of the best of both worlds, quality medical care and constrained pricing.
Yeah, I would agree with all of that, and I would also add that getting the incentives right for innovation, for developing new cures, treatments, medical devices, what have you, that's probably the single most important thing from a public policy standpoint, because the big breakthroughs that are going to make people's lives better, that are going to change, whether people's life expectancies in this country are 80 years or 100 years, the big jumps, the big changes in people's lives, that's not going to come from a government bureaucrat or an insurance company bureaucrat or a hospital bureaucrat figuring out how to cut 1 or 2% cost in something by squeezing this guy or the other guy. That's going to come from some genius somewhere inventing something new, discovering a new treatment, coming up with something that we could never even imagine. And so the incentive for innovation is crucial, because that's where you're going to have these total discontinuities. You got these policy people, these green eye shade guys in Washington saying bend the cost curve, this, that, we're going to slightly reduce it so costs are going up 4% instead of 3% or whatever. That's not how big change happens in the real world. It's not a subtle bend in the curve. It's a sharp change in direction because some genius invented or discovered something that nobody else could have thought of. And so getting the incentives for that, allowing disruption, allowing new market entrants, innovative approaches, stuff that don't fit into any of these regulatory stovepipes is absolutely crucial. And that's why, I think from a free market perspective, the positive message that we sell on healthcare is not just about we need to deregulate Obamacare or repeal it or, shift around how the insurance paperwork goes or what have you. It's really got to be about this is how we're going to slash red tape at the FDA. This is how we're going to slash bureaucracy at these other government agencies. This is how we're going to get rid of all these anti-competition local rules like certificate of need requirements and all the rest of this bureaucracy. And we're going to make it so the guy who wants to try something new, figure something out, develop something, can do it, can try it, can test it. I think you're always going to have some kind of safety regulation because there's going to be a public demand for that. But beyond that, I think people ought to be able to experiment. I think it's criminal that people who are dying cannot get experimental treatments in this country unless they're in a clinical trial. That is crazy. Once it's proven safe, people should be able to get any treatment that's out there, whether it's still in testing or not, for effectiveness. And a lot of times a drug gets approved for some particular use, and then doctors all end up using it for something else anyway. Off-label use is constant. And so what were we waiting for those clinical trials to end on when that might not even be what it's used for? And so I think there are a lot of things that we can focus on. We should still try to repeal Obamacare because it's a disaster fiscally, it's a disaster for healthcare and so on. But if we can build off-ramps for people, give them more choices, and get the incentives right for innovation, some genius is going to cure Alzheimer's, and that's going to change the whole fiscal picture that they're talking about decades out and all the long-term care costs, all of that. They're going to be innovations that change the whole picture. And so I think we got to focus on making that possible, getting government out of the way of those big bang innovations that are going to change the whole picture instead of focusing all the time on, how do we shift the curve 1 or 2% in this direction or that direction.
Well, Phil, as I believe you're aware, Brett and I are technology entrepreneurs. We're not just radio host guys. And in fact, I was on the horn last night with a strategic partner of mine in Africa, and we were actually discussing this very thing. We are planning a combination of hardware, software, and different mobility and telemetry to create solutions where people who, because you can't take a one-size-fits-all, where very poor people with very high needs could have low-cost medical access utilizing technology. Now, I couldn't do that kind of innovation. You let this whole Obamacare manifest itself to the nth degree, and I wouldn't even be able to contemplate trying to create new technologies that could deliver efficient medical care at a low price.
Yeah, it's a huge problem. I mean, the number of venture capital firms that just don't do healthcare deals is very large because a lot of them say, look, the bureaucracy involved is so staggering. A lot of them, they see the opportunity, but they say, you know what, I could focus on some other space that doesn't have all that headache. And so there are things that are already happening that are incredibly exciting, all kinds of things that are already happening. And then there are the things that no one's even thought of yet. And, government isn't going to solve these problems. They're not. But they can get in the way. They can get in the way of the investments happening. They can get in the way of the research happening. And, that to me is, who's going to have that next big breakthrough? What's going to really be the game changer to me is much more interesting than sort of the green eye shade stuff that dominates the whole policy debate on healthcare.
So, Phil, the $1,000,000 question is, in just a few months, are we going to find out a website doesn't work again?
Well, we just found out that healthcare.gov got hacked in July, and they just found out now. So I mean, these guys still can't. Yeah, I don't know if you guys saw this story yesterday. Yeah, they just figured out they got hacked in July, and they don't know how serious the intrusion was and so on. I mean, this federal website has now cost over $1 billion for a website that doesn't work. And I would tell you that number's crazy, but some of the state sites are almost as bad. California was $900 million. Now, at least their website works for $900 million, but state of Oregon spent over $300 million of federal taxpayer money, never signed up a single person. They shut it down. They're going into the federal one now. Now, somebody stole that money, right? They've got an FBI probe out there now. I mean, it's insane. They've spent now over $5 billion on state exchanges in just the 14 states that did their own, and another $1 billion on the federal one. And most of them don't work.
And remember, that involves zero delivered health care. I just want to comment before you and Brett close out. It wasn't just that they were hacked, Phil. It was that they actually had malware introduced, and they didn't know about it for quite some period of time. But then, of course, they told us, "Oh, but don't worry, nothing got out. No personal information got out." I believe that.
Well, I don't think they would even know. I mean, these people have no clue what's going on. I wouldn't tell anyone who cares about their privacy to sign up on that website. I mean, I think
That's an excellent point, and I'm sure that'll, as time goes forward, it will certainly be discussed more. But hey, we can't even focus on any of the fraud here because everybody's focused on Ferguson.
Well, there've been a lot. Here's the amazing thing. Democrats have spent like the past year trying to get everyone to stop focusing on health care and focus on anything other than health care, change the subject to survive this election. But like the two main things they tried to change the subject to were immigration and foreign policy, and those are both worse for them now even than health care was. So I don't know. They've got so many different disasters all over the place that I don't think their distraction strategies are likely to be successful. Not this year.
I agree with you, and I think November is going to be very interesting.
I would agree with that, and I wouldn't write off our friend Jeff Bell in New Jersey either. I think that race is one of the sleepers.
Oh, God, from your lips to God's ears. That'd be fantastic. Anyway, Phil, thank you so much, as always, for joining us. It's terrific. And, folks, again, you can go to AmericanCommitment.org, and please do us a favor and do Phil a favor. You can always sign up, give them a donation, lend them some support, or sign on to their petitions. I'm sure they would appreciate it. Thank you, Phil.
Thanks. Have a good one.
All right, take care. Phil Kerpen, President of American Commitment.